Hello, everyone. I'm just going to give some people a couple of minutes to log on and join us. It is now 12 o'clock, so we have officially started this event, but as I said, we'll just give everyone a couple of minutes to join us.
Hello.
Hi, Kirsty. Okay.
How are you?
Good, thank you. I just told everyone that we will be starting soon. I'm just giving everyone a couple of minutes to join us.
Yeah, it's 12 on the dot, so we'll give them a little bit of leeway. Got a fly buzzing around the room, which is annoying. Hopefully it'll find its way back outside.
If that was me, I'd be like this. I hate flies. They're the worst.
Okay. Who have we got joining us today, Jess?
We have Dr. Hayhurst, who has joined us.
Right on cue.
Thank you. And Helen Davis from who is head of program innovation. She will be joining us.
Fantastic.
Today. How are you, Dr. Hayhurst? You okay?
Yeah, really well, thank you.
Brilliant, and we can hear
Looking
you
forward to
as
today.
well.
Nice to see you again.
Thank you.
Been a while.
It has, isn't it? I think it's all going okay.
Yeah, really good. Really good. Very, very busy at the moment. Just,
yeah, I bet you are.
Yeah, we've only got a week or so to go till application deadline. So anyone that's out there, make sure you get your applications in by the 15th. If anyone is here, feel free to say hello in the chat box, and you can post any questions in there as well that come up during the event, and we'll make sure that we answer them. We've got some staff on standby, and we'll also try and answer those questions in the discussion today. I think we're just waiting for Helen Davis.
Yeah.
And we'll be able to get started. Hello. Hello, Algina. Hello, Emma. Shall I drop Helen a message for you, Jess?
I will drop her a message, but if you want to message her, that's great. Thank you.
Yeah, no problem. 1 moment.
Does it show anywhere how many people are online?
It doesn't actually for us. I think Jess
No,
can
I can't see it.
No.
I think I can see, but it's a little bit hard on this platform to try and have a little tap in to see.
Yeah, Helen's just logging in now, so she'll just be 1 moment. And anyone that couldn't make it today, we are recording the session, so you will get that as a recording on email, because we know how busy our prospective students are. So yeah, we'll send this out if you join us late, or if you aren't able to make it. Hi everyone that's here. We're just waiting for one more speaker to join, and we will get started with today's open day. Hi Rachel. Got everyone from the UK so far. So if you've got any international, we've had people from all over the world joining in these open days the last few weeks. It's just been really exciting.
Shall I see if Helen's okay with logging in, Kirsty?
I've just dropped her a message, and she said 2 minutes, and she's coming online. So she's in our office today, and the internet can be a little temperamental.
Yes.
Hope to be here soon. Feel free to get started if you want, Jess. We can crack on, and Helen can join us as soon as she can.
Yeah, brilliant. Okay, so yeah, I will start. So hello and welcome everyone. Thank you for attending today's open day for our neurosurgery and stroke medicine programs. We are joined by our neurosurgery program leader, Dr. Hayhurst, who will be giving a brief overview of her extensive experience in neurosurgery and an introduction to the course. And then we also have with us today Head of Program Innovation, Helen Davis. She is about to log on, so you'll get to see her in a bit, but she'll be giving an overview of our brand new stroke medicine course, just talking about the module content and who the course is designed for. And then we have Kirsty. Oh, and there's Helen. Hi, Helen. You
Hi
okay?
guys, sorry I'm a little late joining. Thank you, Jess.
Okay.
I could hear you introducing me just as I was getting my stream set up. So
You heard me. Okay.
you.
And we can hear you perfectly, so that's great. I was just about to introduce Kirsty. So Kirsty, she will be going through an admissions process with us. She'll show, and then we will show a brief demonstration of our online learning platform. Student services will be ready in the chat box to answer any questions that you may have for them. And then we'll close to a Q&A where you'll get the opportunity to ask any of us questions. We will be ready to answer them in the chat. But if you have questions that you would not like to put in the chat box and want to send it to us directly, you can do that by just clicking on the feature on the left-hand side of the screen. It just says direct messages, and we will be able to answer those questions. If we don't get round to answering any questions, very highly unlikely, we will be able to email you after this open day. So to start off, I would now like to introduce you to our neurosurgery program leader, Dr. Hayhurst. If you could please tell us about your background and provide us with an in-depth overview of our neurosurgery courses, who it is for, why someone would benefit from completing this program, that would be excellent.
No problem. Thank you very much. Thank you for inviting me today. It's a pleasure to be here. Before I share my screen, then a bit of background about me. So I'm a consultant neurosurgeon based in Cardiff in the UK. I've been there 12 years now. And my clinical specialist interest is skull base and pituitary surgery. And then aside from that, education. And we set up this neurosurgery program with Learner several years ago in the planning, but our first intake was September 2021, and we've had a second intake after that in the March 22, and everybody's really enjoying it. And I think you may be able to hear from some students later, or I'll go through some of the feedback we've had. But it's a very exciting course and lots of interaction and ability to learn for some really, really excellent people, and I'll go into that in a second, so bear with me. Let me share. There we go. So hopefully you're able to see my screen at that point.
Yeah, we can see your screen.
Have you got it?
Yeah.
Yeah, brilliant. Okay, so we'll just go on. So in terms of the course, so it's a first year of a postgraduate diploma followed by a second MSc year of a research project and a research module. But I'll go mainly through the first year diploma, as that's the more structured part of the course. So it is based on the UK core neurosurgery curriculum, which was updated in 2021. And that is really aimed at what we would call early years training, or now called phase 1 and 2. And for our global participants, that's really people who are starting out in their medical careers, aiming for a career in neurosurgery, perhaps have already done a few junior medical jobs in neurosurgery and are starting on their journey towards being a neurosurgeon. It's also aimed at allied health professionals who are currently involved in the clinical care of neurosurgery patients. So they may already be nurse practitioners and maybe looking to push towards a physician assistant type role. And I think this course would be very much suited to them as well. We currently have a range of global expert faculty, all of whom are experts within their own subspecialty, which they will be tutoring, and therefore will bring in a really sort of personal touch to each module, and a lot of really up-to-date information. And what this course really focuses on is mainly the critical analysis skills that I think historically, certainly within surgical specialties, perhaps we're not so used to developing early on in our training. So what we're going to be doing is using clinical scenarios to take us to reviewing the current evidence base of why we do certain interventions. And also we'll be going over certain landmark papers that have changed the face of neurosurgery over the past few years. And it's broken down into 6 modules, which, as I said, cover the core curriculum. And those will start with the assessment of brain and spine trauma. Second module is neuro-oncology. The third is CSF and pediatrics, because those 2 specialties marry together. The fourth one is neurovascular, which always people approach with a little bit of trepidation, but when it's broken down the way we've done it, I'm hoping that you'll find that we've made it an approachable subject, which is enjoyable. And neurovascular has one of the strongest evidence base behind it. So it's a really, really exciting module, that one. And then spine and spinal cord. And then we finish up with a kind of roundup looking at complications in neurosurgery. And there's a very specific reason that we've done it that way, and that we can then go back and maybe recap on a lot of the things that have been brought into the first 5 modules and really drill down on what can happen when things go wrong. And that's a really important part of our medical training, and it actually makes us better clinicians. And our last group of students have really, really enjoyed that module. And each one of them have said it's actually made them a better clinician in their day-to-day jobs. And not only, to then build on this for life and their careers. So if we look at just an example scenario, so this is taken from the neurovascular module, just to show you a little bit how it's going to work. So in this example, it's a 45-year-old man who's come to A&E. So he's not opening his eyes, he's making some sounds and flexing to pain. So his GCS is down and he's got a left hemiplegia, and as you can see, he's got a very large intracerebral hematoma, which is spontaneous. And so what we'd be doing is putting prompts into the platform, which you'll see a bit later, asking you firstly to describe the CT findings, talk about how you would manage this patient from an ABC type approach, but then really start going into, well, what are the options for intervention? And more importantly, why do we make those decisions? What is it based on? What criteria do we use? And what evidence is there out there for these interventions? Are there scoring systems that help us in our decision making, like the ICH score? And we'll go through all of that and bring in the literature and also our own clinical experience. And it's always really useful when students bring in what they've already seen and try and relate their day-to-day experiences in, and learn from other people who may work in completely different environments, different continents, and have different ways of doing things. So it's a real collaborative learning experience. So, that's my roundup of neurosurgery. I'll turn it over to you guys, because I think that it'd be really nice to have some questions. You can either put them in the chat, or I'm happy to answer specific questions directly in the direct box if you would like. So I'll stop sharing that.
That's brilliant. Thank you, Dr. Hayhurst. That was really informative. So we'll go to you, Helen. If you would like to go into detail about the stroke medicine course, that would be great.
Certainly, thank you. Thanks, Jess. As Jess introduced me a little earlier, I'm Helen Davis. I'm Head of Programme Development and Innovation at Learner, and one of the new programmes that we're bringing forward this year is stroke medicine. So this programme is aimed at GPs, at nurses, specialist nurses, and also into secondary care in both UK and internationally, anywhere where the treatment, the prevention, and then the treatment and the ongoing care for people experiencing stroke and other types of attacks of this style are in need of more information on this particular area. It's a broad, general topic in many ways. It affects a lot of patients, and we feel that this multidisciplinary team approach to this particular area is very important. It therefore lends itself fantastically to the type of learning that we provide in the online programme, and we would expect this to attract a number of different ranges of careers and people in different roles wanting to learn more about this important topic. Prevention is really high in the approach to stroke, but also then if we do have patients who have experienced those types of symptoms and have received treatment, the aftercare and the rehabilitation also comes way back into primary care. And so this particular topic area is popular across a number of areas of care through the healthcare systems of the UK, and increasingly international awareness is growing on this particular area. So I thought I would just show you a quick overview. I'm just going to try and share my screen just as Caroline did there, just to see what I can show you there for stroke. So bear with me just a second. I'm just going to show you the module outlines and go into a little bit more detail of what we have available for the new programme. Just trying to get it to share. Bear with me. Okay. I think you can probably see that. Can you see that?
Yes, I can see that.
Brilliant. Okay, so this is our master's program in stroke medicine, year 1, in exactly the same format as our neurosurgery program. Just described a little earlier, we have year 1, which are 6 modules addressing the main core areas of medical knowledge and clinical knowledge that's required for this particular topic area. And then if you go on to do the master's in year 2, then you would be wanting to produce a professional project. Your time in the first year covering these broad areas of the topic, that time is going to be spent with realistic case scenarios. So our stroke team are currently bringing together the content that's going to provide really realistic scenarios that are patient-based, that feel like the scenarios that you may address in your own particular role currently, or indeed if you're preparing to go on to a higher level role where stroke medicine was an important factor, then those would be the type of presentations that you would expect to see. By making these presentations as realistic as they are, it means that knowledge is applied straight back into your working life, either, as you say, just as you are in the role that you are in currently, to improve your knowledge and to improve your leadership in that particular area, or indeed to prepare for progression into another more specific role. So the topic areas are broad to cover all of the areas that we would expect somebody to want to have information about stroke medicine, and to a master's level of information, but realistic and always presented in a style that is easy to understand and easy to then address back into your own working practice. So just to quickly go through each of the modules. Module 1 is a good overview and a good introduction through to the main areas of stroke and TIA, the definitions, the diagnosis, the epidemiology, and also stroke mimics. There are many symptoms, there are many presentations and missed presentations with patients who may be susceptible to stroke, and it's really differentiating between those various symptoms and the way that patients are presenting. Module 2 will go into the risk factors of stroke and TIAs, primary and secondary prevention of these. So again, a very high lifestyle approach to this whole program, where prevention is by far the best approach to this, rather than having to treat people who have gone through those symptoms and presented with those problems later on. So Module 2 really goes into those risk factors. Module 3 looks in closer detail at TIAs, the diagnosis, the management and the guidance for this particular area of this specialty. Module 4 is about hyperacute and acute diagnosis and management. Module 5 goes into the investigations and mode of therapy and stroke in special circumstances. So special areas, the more unusual presentations, the more complex presentations are definitely involved in Module 5. By that point, the learning groups that are coming through this program will have a good grounding and indeed will have shared information from their own practice about particular cases and particular presentations. So Module 5 is a good area for investigation and deep discussion, much more research into the more unusual cases and special circumstances. And then Module 6 really goes into the leadership and into the ongoing care, so rehabilitation for patients who are coming through that process, but organising a stroke service and taking that leadership role much further into the ability to bring up that type of a service and to present it well, again, with a multidisciplinary team and with yourself as the authority in stroke medicine coming through this programme, having that basis of information to take that forward. That should all prepare you then to write your own professional projects. If you go on to do the masters, which many of our students do on these types of programs, it gives you a really good grounding through those 6 earlier modules to be able to decide which particular area is most relevant for you for your practice, and indeed is the most interesting for you to research and then to write up into a professional project. That includes an essay, and includes a proposal at the outset of that, and an essay which involves some activities in research and the development of that story to present a paper. And that's a sort of a brief overview of the whole programme as it currently stands. I'm just stopping my sharing, so sorry for that, and I'll just come back to the screen. There, you can see me there. Okay, so the team that we have to deliver this programme are all specialists in stroke medicine, very much from a secondary care environment, and very high in their particular areas of expertise, but bringing this very much for a primary care perspective and for an international audience as well. So anybody with an interest in stroke medicine and improving their skills in that area, they're already at a postgraduate level for clinical roles and would want to take that forward, then this is certainly a programme that would be of interest to you.
That's excellent. Really interesting courses there. I'm not quite sure you have stopped sharing your screen.
Oh goodness, I'm so sorry.
If you
there we go. Is that better?
Perfect. It's come back now, just because I need to share my screen later on. So yeah, brilliant. Thank you both for those introductions. Now to you, Kirsty. We will be going through an admissions process with yourself. Thank you so much for being here today.
No problem. Yeah, so I'm Kirsty Betteridge. I'm the head of student recruitment and marketing for Learner. So yeah, I think Jess is going to do a little Q&A with me, so we can just outline the process of applying for one of our courses and take you through that.
Exactly. Yes. So my first question to you is, how does the application process actually work? So can you talk us through from how they apply to what happens when students get accepted, everything up until they get handed over to student support?
Yeah, of course. So once you've decided on the programme that you want to study, you have a choice between applying for either the postgraduate diploma, which is a 1-year programme, part-time or completely online, and all of our postgrad diplomas are the same, or you can sign up for the full 2-year MSc. If you think that you'll be interested in the MSc, but you're not sure if you can commit to the full 2 years, you can certainly sign up for the postgrad diploma and then make that decision at the end of that course as to whether you want to carry on and do the MSc, take a break, come back and do the MSc, or just to get the postgrad diploma qualification. So once you've decided on what course you're looking for and what level you're looking to study at, postgrad diploma or MSc, you go to the relevant page on our website, and there's a pink Apply Now button, and you hit that and you put in your details and open an account. Before you get started on the application form, I'd strongly advise that you get all your certification and paperwork in order. We'll need proof of your qualifications. We will need proof of your English language proficiency if you didn't study in a English speaking country. We'll talk a little bit more about English language requirements in a moment, I think. and also some names and contact details of references for us. So I'd get those together before you get started, and then once you've got everything, it should take you 20, maybe 30 minutes to complete an application. It's not a too long and involved a process. Once you've submitted your application, the admissions team will review this, and they'll contact you via email if there's further information that they require. And then hopefully after that point, once we've got everything we need, you will be accepted onto the course. At this stage, you receive your acceptance letter via email, and you're able to secure your place on the course by paying the initial deposit payment via your application dashboard. It's worth noting here that your place on a course is not secured by the acceptance. It has to be secured by paying your deposit. We are now fast approaching our application deadline. We've got applications flying in and deposits coming in very quickly, and some of our programs are starting to look quite full, where we've got more people accepted than we have spaces left on the program. So to avoid disappointment, we'd always recommend paying that deposit so that you can make sure your place is secure to start in September.
Perfect. I know that you briefly just touched on what they need to include with the application, but can we talk about like general qualifications and experience, just to go into some detail about how some courses are different than others and it's not one size fits all, just guidelines?
Of course. Well, luckily we've got Dr. Hayhurst and Helen here today who can answer any specific questions around admission to the neurosurgery programme or the stroke medicine programme. As a general guideline, you will need to hold a medical degree or an undergraduate degree in a health-related science, and also be working within the field that you wish to study. Obviously, neurosurgery is quite a niche topic compared to some of our others, like medical education, and so those that are applying for neurosurgery will need to be on that pathway, whether they are doctors or nurses. I'm sure Caroline can answer any more questions. I think I can see one or two in the chat box around neurosurgery specifically. If you don't hold an undergraduate degree, however, for example, hold a diploma in nursing and you have all of the relevant clinical experience, we would still encourage you to apply for our courses. You might be set an assignment, which would be similar to the work you can expect during the course, just to make sure that you are comfortable with working at that level 7. So not having a degree is not always the be all and end all, but we'd suggest that you apply anyway if you've got the relevant experience and something like a diploma in nursing.
That's really helpful. Thank you, Kirsty. So what about English? Can you explain the IELTS if someone doesn't have it? What can they take instead?
IELTS for University of Buckingham is you'll need a score of 6.5, I believe. And if you don't have that, there are some other things we can accept, particularly if you've done any undergraduate study or any prior study in the medium of English, then that can be accepted. If you've done any teaching English as a foreign language qualifications, they can also be accepted. So if you haven't got IELTS, but you have one of those, or you're not 100% sure, just contact admissions and we can take you through the process. If you were applying for a University of South Wales programme, the requirements are slightly different, and there are other alternatives as well. So, but for today with the Buckingham programmes, IELTS needs to be 6.5, or there are a couple of other options.
Brilliant. Okay. And what about references? So how long does it have to be? How does it work with that?
So we ask for the name and email addresses of 2 referees. They can be work colleagues, employers, former tutors, someone that knows you in a professional capacity. And we will contact these and chase them for you. For the majority of the courses, we do only require 1 reference. However, we ask for 2 because this is the area that often delays applications. So by asking for 2, that hopefully will just speed things up a little bit for you. And the reference, we send out a very short reference form that just essentially asks in what capacity they know you and whether they think that you're suitable for the programme. So it's quite a simple, short process for the referees. I'd always just give them advance notice that you've provided their details to us, so that they're going to be looking out for the reference request coming through.
Okay, great. And with personal statements, how long should that be? What do they need to talk about?
Well, obviously, the personal statement is, as it says in the title, personal. So there isn't really any right or wrong when it comes to it. In terms of length, we're looking for around 500 words to a maximum of 3,000. But really, what we want to get from your personal statement is an insight into you, an insight into the work that you're doing currently. And then also your motivations around studying the programme. So, what's made you apply for the course? What are you hoping to gain from taking the programme? Are you looking to start some specialist training? Are you applying for promotion in work? Or are you looking just to expand on your knowledge and clinical skills? So really, we just want to kind of get an insight into you and your motivations.
Brilliant. And then what happens after someone's completed their application and they have got accepted?
As I mentioned earlier, they will get an acceptance email, and after that, you'll just have to pay your deposit, and that will be your place secured on the course.
Brilliant. And then what if they are rejected? So could they apply again next time with just more experience?
It really does depend. So if you were rejected, you'd receive a detailed email and we'd explain exactly why we've been unable to offer you a place on the course, whether this is due to lack of qualifications or clinical experience. In the case of clinical experience, then yes, that is a matter of time, and we would recommend you go away and you spend that time gaining that experience, and you can come back and apply again.
Brilliant. Okay, I think that's all the questions, the administration questions I wanted to ask, and the ones that we typically get. So thank you, Kirsty. It was really
No problem.
reassuring.
I will
If you
probably just add there, sorry, Jess. If anyone is kind of on the fence or not sure about whether the course is right for them, we're more than happy to have a call with you and talk through your concerns. It's no small undertaking doing a postgrad qualification. These are full university master's degrees and postgrad diplomas, and you are expected to dedicate a significant amount of your time to studying on the course. We usually say around 20 hours a week, but logging in little and often every day. It's also a financial commitment as well. So we are happy to talk about your circumstances currently, and we can advise as to whether now is the right time for you, or if it might be a better idea to defer your application to a little bit later. Hopefully we can allay any fears you've got. Our courses are highly, highly flexible. As Caroline and Helen have mentioned, the learning takes place on an academic forum for the postgrad diploma, and is very case scenario based. This means there are no lectures, there are no set class times, there are no seminars. You study whenever and wherever you want, and the real benefit of this is that for busy healthcare professionals, you can take bits of time in the day, perhaps you're commuting to work on the train, to log in, have a look at the scenario, have a think about it, log in again later once you've managed to do some reading, and you really can fit that around your lifestyle. But as I said, it's no small undertaking, so it's definitely something to think about long and hard before you actually take the plunge.
Yeah,
Thanks, Jess.
no, it's fine. Thank you so much, Kirsty. That was really helpful again. If you have any questions off the back of that, then please pop them in the chat box or message us directly. We will be able to answer them. I am about to play a video demonstration of our online learning platform for you all now. In the video, you'll hear Ben, one of our colleagues from the Student Services team, showing you what our platform looks like, where you'll find tasks, reflective journals and discussion boards, and much more. I will just share my screen with you all now. If someone could just let me know that it's sharing okay, because sometimes it doesn't work very well.
Welcome to our open.
Let me just stop that. Is that working okay?
Yeah, that's all fine.
Yeah, brilliant. Okay, I will play it now.
Welcome to our open day at Learner. My name is Benjamin from Student Services. In this short video, I'll be showing you a brief introduction to the learning platform Moodle, where all of your studies as a student at Learner will take place. When you start the application process with us at Learner, you will be provided with your login details to access Moodle, the learning platform. The login process is simple and straightforward. Press the blue Learner Login button here, and then simply enter your username and your password into the text box and click the Login button. Once you have logged in, it will take you to your dashboard. This is the easy to navigate homepage where you can access your modules and all of the supporting resources needed to aid you in your studies with us at Learner. For today's introduction, you can see Cosmetic Medicine Module 4. To access the module, press the Explore button seen here. Please be assured that the Moodle platform is interchangeable with all of the programs that we offer here at Learner. So please do not worry if you are not studying this particular program, yours will look the same. As you can see, each week has its own individual section. For the topic of today's introduction, I'll be showing you week 1 and how to access the academic forum. You can access the academic forum, which is the weekly equivalent of an in-person seminar in forum form, by clicking here. As you can see, there is an example post of a welcome post here, as well as an example on how your case scenario post from your tutor would look on the platform. Once the tutor has posted the case scenario, you are then able to respond with your research and interesting discussion points via this direct thread. Each module will be in an individual section, such as the Study Skills Orientation module, where you will access a range of introductory guides and videos that will discuss the platform in greater detail. The Instructions and Resources section, where you can access the marking criteria and easy to follow guides for each component of your module. And the Learner Library, where you can access your reading resources, academic search engine, and partner university information. This is the Learner Library, where you can access a wide range of resources that will aid you throughout your studies with us at Learner, such as your reading resources, a selection of academic search engines, such as Google Scholar, and further useful resources such as Mendeley, an external, free-to-use reference managing system. As you can see via the drop-downs, there are guides to literature searching, a guide to referencing, and a guide to poor academic practice and plagiarism. Furthermore, if you scroll down slightly, there are a range of open access ebooks that you can use to aid you with your studies. Further down the page of the Learner Library, within the Bibliographic Resources section, you are able to find academic search engines such as Academic, BMC, and Cochrane Library, and many more, which are there to be utilized and assist in finding the most suitable sources for your research. If you scroll further down the page, you can find the Useful Resources section. We recommend that you take full advantage of these, such as Mendeley and Grammarly, which become very useful in your studies. At the bottom of the page, you can find your reading resources. When you begin your program, you'll have access to these resources for your respective program and find all the relevant materials and reading resources for that particular week and for that particular module. Though our platform is designed to be extremely easy to navigate, onboarding onto a new online platform can be overwhelming. In each section of the platform, you can find direct links to contact the Student Services team, who can answer any queries or questions that you have throughout the entirety of your studies with us at Learner. We hope you have found this short introduction helpful to your application, and we hope to be onboarding you as a student with us at Learner very soon.
Okay, just stop sharing my screen. Has that worked? Have I stopped sharing my screen now? Brilliant. Okay, so I hope you were all able to see that video okay. If not, we will be putting it in the email after this event, so you'll be able to watch it then. But yes, Student Services, they are in the chat, so you can ask them questions today. We do hope you enjoyed this open day. We are now at the end of our event, but before we close, we would like to spend some time answering some questions. I know Dr. Hayhurst has been answering quite a few that have come in the chat box, and I'm more than happy to just go through them so that when, for some people who haven't attended today, when they get the full open day video, they'll be able to see some of the questions and answer, well, they'll hear some of the questions and some of our answers today. So I will just go to the top. Rachel from England asked, is the neurosurgery program suitable for nurses? And Dr. Hayhurst replied saying, hi Rachel, yes it is. If you are working within acute neurosurgery, then you would have knowledge of the topics we will cover. It will be a lot of reading and some scan interpretation, but definitely achievable, and that she is happy to chat about that in more detail.
How many nurses are on the course currently, Dr. Hayhurst?
No, we don't actually at the moment, but we do encourage, and I think, we'd love to have some nurses on, but I think it is with this prerequisite that it is a lot of work. And, you've mentioned earlier, and it comes down to another question at the bottom there, is it is a big commitment. A master's degree is a big commitment, and you're doing this at the same time as your normal job. And I think almost doubly so, but for nurses, that it will be a step up. It is, talking about things on a clinical level. That when I made the comment, if you're in acute neurosurgery as a nurse, you will have exposure to all of these conditions. And with the way that we work now in terms of multidisciplinary working, it should be within your sort of day-to-day remit. But putting that extra academic hat onto it with the literature and perhaps some scan interpretation as well, which isn't, it's not a major feature, it's not 100% of it, then, it can be a bit of a big jump, but it is doable, and we have specifically made the content so that it is doable.
Yeah, that's very nice. We also had a question from Algina. She asked, is in the neurosurgery program, do you learn about different healthcare systems around the world? And Dr. Hayhurst was able to answer and said, yes, we do have, yes, we do, as there are students from all around the world. They all bring on their own experience to the forum. This year we had students from Trinidad, Canada, Singapore, and Australia, which is excellent. And I can see that she also added the faculty are also based around the world as well. Emma from...
I'm just going to interrupt you there, Jess, just to say that is one incredible feature of our programs, because they can be done anywhere. Time zone doesn't make a difference as long as someone's got an internet connection. It means that you really get that global perspective that you wouldn't be able to get on an on-campus program. You get exposed to people who might deal with completely different healthcare systems than you do. Totally different conditions might be prevalent in their area, and you really get that different perspective and viewpoint on the cases that are posted in the academic forum. So that's a really, really nice part of what we do. And equally, as Dr. Hayhurst just mentioned, with looking to have nurses join the neurosurgery program. I think, Helen, you'd agree with the stroke program. We're hoping for that to be very much multidisciplinary as well as international. So you really get that mix.
Indeed, yes, very much so. And as I say, with a broad sort of topic area, we would expect teams to be coming in from various backgrounds and various regions as well. And that mix, as you say, is so important. And we're able to share those experiences within the academic forum, just in the nature of it. The tutors very much facilitate those conversations. They will lead with a discussion topic, but then it's up to the group to bring their own research and to bring their own experience, or indeed, if they don't have direct experience, particularly in some of the key areas, then learning from each other's experience and sharing those scenarios, and then going off and researching is also a big part of it. So
and reflecting as well, Helen. I don't think we've mentioned that too much, but as well as the case scenarios on the academic forum, a part of what you'll be doing will be reflective practice. And that's all about thinking about what you're learning and how you apply that into your current role and your day-to-day job. So that's another really, really important part of the programme, and is part of the assessment as well.
Okay, brilliant. Thank you for adding that. Emma from Wales has asked, will I get the certificate once I complete the neurosurgery course? If so, who will it be from? We don't have learner on the certificate. It will be the university, which is University of Buckingham. I am saying that right, am I?
Yeah.
So that's who will be on the certificate.
It's also worth noting at that point that the stroke programme is currently subject to validation. So it hasn't been validated by a university partner as yet. We're anticipating it will be validated, ready for the September programme, and we can accept applications and even admit and take payment for that. But just to make you aware that it is still subject to validation by a university partner.
Brilliant. Rachel from England has asked, what is the difference between the diploma and the MSc? Obviously, from what Dr. Hayhurst and Helen Davis has gone through in their presentation, they outlined the differences, but we'd be more than happy to go through that again just to make it clearer.
I think the main difference being that the PG Dip is the first year of an MSc. So the PG Dip is year one, and you can stop there, and that's got the six modules that are generally the case scenario based modules and assessment. The second year, the MSc is all about your professional project and a research project. So that's kind of the main difference. But as I mentioned earlier, you can start on the PG Dip and see how you go, or you can sign up for the full thing at the start, which we're seeing a lot more people doing at the moment, actually, which is great.
Yeah, with the MSc modules, they are designed to help you recognise and understand, interpret and apply methods used in healthcare research, and you can critically appraise the various methodologies specific to either neurosurgery or stroke medicine. So it just goes into a bit more detail with the MSc. Pedro from United Kingdom has asked, what careers have recent neurosurgery graduates gone on to?
Yeah, do you want me to pick that one up, Jess?
Yes, please. That would be brilliant.
It's such a broad range of people. As I said, it's our first cohort are just completing now. And because of the nature of the academic forum and the reflective journals, we do get to know people really, really well, and sort of where they're at and how their last year has gone. And, a number of people have said that they have gotten to a registrar or senior clinical fellow job, and they're starting in August. And some of our international trainees are in the early years of their own formal training programs. So everyone's at slightly different levels, but yes, we've certainly seen a number of this year's cohort, get really good jobs coming from August, and seem really, really happy with how this year's progressed and are going on to the MSCs.
Fantastic. And I'm right in saying that this is the only MSc neurosurgery program in the world. Is that right?
Yes, it's certainly the only online one.
Online.
There's a couple of research sort of MPhils, etc. But no, we are the only online accredited neurosurgery MSc in the world.
Perfect. So if you're looking for something to add to your CV, that's really going to set you apart from the competition. And neurosurgery is extremely competitive. So
yeah, a very unique selling point. And I can see that Dr. Hayhurst has answered that in the chat box. That's great. But to add, there are also opportunities to publish your work with us at Learner, as well as the possibility to become a tutor upon completion of the master's programme.
I think some of our best tutors are actually former students, and we do have a lot with many of our courses that have run for a long time. So yeah, that's a really nice opportunity to kind of give back as well.
Yeah. Rachel from England has asked, what payment options are available? Do you offer scholarships? I can see that we have replied in the chat box. So students are able to make payments via direct debit, bank transfer. Students are able to make payment in full if circumstances allow. However, our finance team do offer individual payment plans to students if required. Currently, Learner does not offer scholarships. However, please you can refer to our website for further options that may be applicable. We'll be able
That's not quite right. We do have one scholarship fund, which is available only to students who live in Hanari Group A countries and who are undertaking the 2-year MSc programme. If that applies to you, we have a very limited amount available. It would fund 50% of your fees. So do email admissions@learner.ac.uk if you'd like some more information on that and wanted to apply for that scholarship. It's worth noting that our payment plans are all interest-free, and then you split the payments up per module. Alternatively, we do have a student loan company called Lendwise who we work with, and if you wish to, you could have a look at what they've got to offer in terms of longer term loans that do have interest attached, but we're unable to give any kind of financial advice around that. So if that's an option you'd like to look into, then you can speak to Lendwise.
Thank you, Kirsty, for adding to that. I can see there's a question from Emma. She has asked, would I need to take time off work to do the course? And we have said before on this event that no, our courses are 100% flexible. You can log on anytime, anywhere, whether it's on your commute or whether you have spare hour or two in the evening once the kids are sleeping. You can fit it around your lifestyle commitments. You would not need to take time off to do any of our courses. Just seeing if there's any more that's come through. Yes. Algina has asked, what sort of case scenarios do you focus on for the neurosurgery course? Dr. Hayhurst, would you be able to give an example?
Yeah, sure. I mean, I gave one example in the talk, but you know, as we said, it's broken down into 6 modules. So, for example, the trauma module, which is what we begin with, you know, our first week is looking at, you know, emergency management, ATLS type scenarios. So, you know, a road traffic accident, patient comes into the emergency department. We talk about, you know, CT modality, etc., stabilization of the cervical spine, and then we move through each week and sort of build on the previous week. So each week there are 2 full clinical scenarios that we present to you, which are all actual, you know, events that have happened. They are based on things that we have seen as faculty with imaging. And there's also a weekly quiz at the end of the week, which sort of aims to sort of round up the knowledge of that week. You know, like a single best answer type quiz. So yeah, so like moving through, for example, then Module 2 is oncology. So we will present you with a clinical scenario of, you know, patient's symptoms. This is their imaging. You know, what do you think this might be, and what's the most appropriate management? And so, for instance, if it's a patient with a glioblastoma, we would give you the history and the imaging, and then say, okay, we'd want you to be thinking about, well, okay, what's best practice here in terms of multidisciplinary sort of meeting management is something that we would adopt in the UK. Other people will bring their other experiences into that, but we'll be looking at what's the evidence. So, STUC protocol, looking at chemotherapy, radiotherapy, and gross total resection of tumour. So yeah, everything is covered through this sort of medium of two scenarios a week, and we've pretty much tried to cover the entire curriculum that way over a year.
That's really informative. Thank you, Dr. Hayhurst. I'm not sure if there's any other questions. I'll just give it a couple of seconds, see if there's any more that come through. I think that might be it.
If you think of any after the event, or if you're watching this on recording and your question hasn't been answered, then feel free to drop us an email, and we're more than happy to answer any questions you have.
I think that is all the questions that we have. As Kirsty said, if you do have any more, we will be able to answer them after this event. But thank you to all, and thanks to everyone who has attended. We hope you found today very beneficial. And if you would like to learn more, we will be sending an email out, so you'll be able to get the opportunity to ask student services, admissions, our faculty any questions, and potentially book a call with them too. But yeah, thank you everyone for attending, and good luck with your application. Hopefully you get it in soon, because we've only got 6 days left.
Thank you. Thanks, Dr. Hayhurst. Thanks, Helen.
Thank you, everyone. Bye-bye.